So today we are going to talk about cataract. So I'm going to start first. So today's agenda is this. So we'll go into each topic. So what are cataracts? What do you mean by cataract? So cataract is one when the lens becomes opaque. You call it as a cataract. Normally, when you're young, the lens is transparent, but with age, it becomes cloudy. That's when you call it as a cataract. As the clouding of the lens becomes more denser and denser, it allows lesser light to enter and your vision starts to become blurry.
How do cataracts develop? So, yeah, see, normal, it's a cataract is a normal aging phenomenon. If you see majority of the patients, it is because of aging. It's like graying of hair. So you have a lens, all of us have lens in our eyes, which is actually transparent and allows whenever we look at an image, light rays pass through the lens and it has to get focused on the retina. That is why we see a clear image here. So aging, what happens? Changes start occurring in the lens and cataracts develop. So other than aging, what are all the other causes of cataract? When people have diabetes, so diabetes, when blood sugars are not under control, these patients develop cataract at an early stage. And some patients on corticosteroids, so oral corticosteroids, they might be having some renal problem, some autoimmune problem, also any other disease where they need to take corticosteroids for a longer period of time. So they develop cataract as a side effect of cataract or corticosteroid usage. And those people who work in too much of sunlight, so when they get exposed to UV light, so these patients develop cataract earlier. Other than that, smoking is an important factor which can lead on to early cataract formation, and alcohol, excessive alcohol consumption too.
So, what are the symptoms? If you look at what are the symptoms, first of all, blurry vision. So, the blurry vision could be for distance, could be for reading, or generally they could have a complete blurred vision. And there could be multiple images, what we call it as a polyopia. So, if you're looking at one image, one light, it might appear like four lights for them. And poor night vision. When you drive in the nights, you will opposite headlights, you will not be able to face it. So much of glare will be there when you are driving in the night. Then colors will be looking little faded. So instead of a blue, they will say it as a green. Some kind of a color change can be there because of the cataract. Sensitivity to light, as I told you, glare is going to be much more pronounced whenever you're having a cataract. And when you're seeing certain images, ghost images, like when you're seeing a yum, an M adjacent to it can be seen. So frequent changes to your eyeglasses also happens whenever you're developing a cataract. So
So you can compare, say how a normal person sees a image, and same a cataractus patient, how do they see the image? Here you can see, so a blurred vision, this is how the cataract patients will see a picture.
So, how are cataracts treated? What are the options for cataract treatment? So, if you look at it, there are from age old time, from Shishruta's time, we actually started doing the cataracts in India. But the cataract has evolved over time. So, from a large incision surgery where people used to like be with a green cloth and 40 days at home, not doing anything, those days are completely gone, and we are no more using those kind of techniques. The modern cataract surgery is a microincision surgery. So the microincision surgery, it what it does is it breaks the cataract into small pieces and we suck it out, and then you replace the lens with an artificial intraocular lens. So this is what is a modern cataract surgery. So if you look at the options, there are three main options. One is a manual procedure where you make a small incision and remove the cataract and implant a lens. The second method is called as a phacoemulsification, in which an ultrasound energy is used to break the cataract into small pieces and we suck it out. The entire incision is less than 2.5. And so basically, the healing is very fast. The patient recovers very fast in the phacoemulsification, and you put in a foldable lens inside. So the lens goes inside and unfolds there. And now the latest being the robotic or the femto laser assisted cataract surgery. So earlier we were using the phacoemulsification or the ultrasound energy. Now for breaking the cataract, instead of using an ultrasound, you can use a femto laser. So what it does is, it is very precise. Whenever you're talking about laser, it's a very precise thing. So the incision is also made by the laser. The capsular excess, the opening of the cataract is also done by the laser, and breaking of the cataract is also done by the laser. The emulsification is done by the phacoemulsification, and IOL is put, which again is going to be a foldable IOL.
So there are so many types of lenses. Like usually when patients come to us for cataract surgery, they'll ask us like, what are all the types of intraocular lenses? So if you like, how do we decide upon the IOL to be implanted? It basically depends upon the lifestyle of that particular patients and their needs. So generally there are three types actually. One is monofocal lenses. So monofocal lenses will give you good vision for distance. Generally if the patient specifically wants for near vision, we can make it for near vision clear, and then we can give glasses for. So either distance or near vision will be clear, and they will require glasses for the other distance. The next one is multifocal lenses. So multifocal lenses, you have EDOF, we call it as extended depth of focus lenses, and trifocal lenses. So these, depending upon the lenses, they provide good vision at varying distances. Some lenses are good for near and intermediate. Some lenses are good for far and intermediate. Some lenses will focus for all the distances. And one more lens is called toric lens, which will correct astigmatism. Some patients will have a cornea, asymmetrical cornea. The curvature of the cornea will not be smooth. It will be irregular cornea. So that can be found out when we do the refraction. We can find out these patients, and we suggest specifically toric lenses for these patients.
So what are the pre-procedures do's and don'ts? So before they come in for the surgery, they'll be made to apply antibiotic drops, and on the day of the surgery, a dilating drops, so that they need not come and wait in the operation theater when they need to go ahead with the surgery. So prior to the surgery, application of a drop, and you have to take a proper shower and everything, because after the surgery, you will not be allowed to have a head shower for a week's time. So have a proper shower, rest and relax. So relaxation is very, very important. If you're very anxious, your BP can go up, so that can hinder the surgery. So rest and relax. No eye makeup on the day of the surgery, and avoid wearing contact lenses at least 3 days prior to the surgery, because the cornea can have a warpage because of the contact lenses. So we don't want the contact lenses to be on till the date of the surgery. And do not consume alcohol at least 24 hours before the surgery.
Post procedure. So what are all the do's and don'ts? So normally, so if you see now, the cataract surgery has become very advanced, and cataract is one of the simplest surgical procedure. If you compare all surgical procedures, whatever we get it done throughout our body, so eye surgery is one of the simplest procedure. You can resume your activities like watching TV, going out for walking. Within like the next day onwards, they can start doing all this. And only thing is, whatever drops prescribed, so post-operatively, whatever drops prescribed, that has to be followed religiously. So that is very important. And one more thing is, before application of eye medication, so whoever is going to apply drops, they have to wash the hands with the water and soap and water, and then they have to apply. So every time they put drops, they have to make sure that they wash the hands and put. That is very important. And one more thing is, the drops have to be kept in a safe place away from dust. And the eye should be like frequently, it should be cleaned. So we will prescribe them sterile wipes with which they can clean their eyes periodically. And if there is any problem like any pain, undue redness, or sudden blurred vision, they have to contact eye surgeon immediately. And eyes should not be rubbed, and undue pressure should not be applied on the eyes. These are all the normal post-op prescription. Precautions we tell them. And one more thing is, for the first 10 days, we ask them to avoid a shower or face wash. So water, they should not splash water onto the eyes, and water should not get into the eyes for the first 10 days after surgery. And any activity which might cause damage to the eye should be avoided. And any strenuous activities like weight lifting and any bending, acute excessive bending and acute lifting of heavy weight should be avoided, because these activities might increase the pressure in your eyes and it will delay wound healing.
So tips to protect your eye and reduce cataract risk. So basically, cataract cannot be completely avoided. As you know, this is an age-related process. So it's a normal physiological process. So over time, as like graying of hair, this lens becomes opaque. So, but what can be done to delay the onset of the cataract? One is quit smoking, definitely. Eat healthy diet, like lot of fruits and vegetables, which are rich in antioxidants, actually prevents the cataract risk. We can delay the progression. And other associated health problems, if they are a diabetic or a hypertensive or any other issues they have to be brought under control. If their uncontrolled diabetes is there, the chances of developing cataract is much higher. So like that. And wherever steroids can be avoided, because steroids also can lead on to cataract formation. And wearing sunglasses, UV protection is one another important factor which we consider. So wearing sunglasses when you're going out in bright sunlight actually helps. And reduce alcohol use, and have a regular eye examination. So regular eye examination is very, very important, because even in cataract, there are two variety of cataracts. One is a cortical component and other one is a nuclear component. In the nuclear component, even though the cataract can be rock hard, they will not have much symptoms. So unless you have an examination, you will not know. So it's better to operate cataract when it's in the early stage rather than waiting. So basically, don't delay checking up. So on a yearly basis, if you check up, you know, okay, this cataract has started to form. Right now, we can wait for 6 months, whether we can wait for 3 months, what it is, we'll come to know about it. So regular eye examination is very, very important, not only for ruling out cataract, to look at the intraocular pressure and to look at the retina. And age-related changes in the retina can be prevented if we have a regular eye examination. So
If you have any questions,
Uh, Doctor,
yeah,
there are some questions.
yes.
Shall I raise that?
Yes, please go ahead.
Okay. Somebody has asked, can I find out by myself if I have cataract in my eyes?
Can you find out?
Can I find out by myself if I have cataracts in my eyes?
Definitely, if you have a glare, if you have a blurry vision, you have multiple images, definitely you can find out that you have a cataract. But there could be other reasons for decreased vision also, like a refractive error also can have a blurry vision. So just by having a blurry vision, you cannot come to a diagnosis of a cataract, but possibility of a cataract can be thought through. So whenever you have a blurry vision, you need to go and examine with the doctor. Then we'll be in a better position to tell you whether it's just a refractive error which can be corrected with glasses, or whether it's a cataract which needs a surgical intervention.
The next question is, are all the cataract surgeries safe? Because this is the same question asked me, sir, பயமா surgery சொல்றீங்க. This is a common question my patients also ask me, doctor.
Right.
see, as far as the cataract is concerned, one thing is surgery is the only option, because the clear lens has become white. So the only procedure which can get rid of the clear lens is only through surgery. So we have to remove that cataractous lens and replace it with an artificial lens. As far as cataract surgery is concerned, actually an experienced surgeon can complete surgery within 10 minutes. Okay, so there is nothing to worry about it. It's a very simplest, as I told you earlier, it is one of the simplest procedures will happen. Before you get scared of the surgery will get over actually.
And not only that, earlier we used to give injections to do the surgery. Nowadays, no injection is even needed. We put the drops under topical anesthesia, the surgery can be done. So you don't have a patch, you don't have anything. You finish the surgery, wear your protective glasses and go home. So it's as simple as that. So there is nothing to fear for cataract surgery.
The next question is, can cataracts come back after surgery?
No. See, once cataractous lenses is removed, for lifelong it is removed. That is it. The people generally, this doubt is asked by many patients. So once cataract surgery is done, cataract is removed, you will never get back cataract. And one more thing is, we replace the cataractous lens with an artificial lens. This artificial lens doesn't have any expiry period in your eyes. You don't have to remove after 10 years, you don't have to remove it and replace nothing at late. Whether you get cataract surgery done at the age of 20, 40, 60, it will remain in your eyes for lifelong. So there's no expiry period for the lens we implant also, and cataract, you will never get it back again in your life.
The next question is, are cataract surgeries covered under insurance?
See, most of the cataract surgeries are covered under insurance. I don't think there is any contraindication or which one to stop the insurance. So whenever they have a cataract at whatever age it might be, it could be a congenital cataract in the children also or in the adult. If they have a cataract, usually 99% it is covered under the insurance.
Doctor, one more question is, can cataract cause double vision? Sometimes people say this.
Double vision, more than double vision, it can cause ghost images. So ghost images is like when you're seeing one image, there is a ghosting surrounding that image. That kind of an image is more common with the cataract, or multiple images, what we call it as a polyopia. If you are having a double vision, it could be because of a nerve problem that might not be related. But if you are seeing two people or something like that, it might not be connected to cataract. You need to have an examination to find out whether you have a nerve problem.
The next question, doctor, is there a link between diabetes and cataract? As we all know, diabetes, we are the leader. Is there a link there?
Very much it is linked actually. So what happens, diabetes generally, when there is fluctuation in blood sugar, so it will not be controlled like throughout. If you say morning when we take blood sugar, it will be high. Sometimes when they skip the tablet, when they are not following the diet, or when they don't exercise, sometimes the fluctuation of blood sugar will always be there. So when blood sugar level goes up, it can have an effect on the lens proteins. So those with chronic diabetics, once they have diabetics and uncontrolled diabetics, they tend to get cataracts earlier than normal people. Suppose normal people get cataract at age of 40, 50, 55. These patients will take little earlier, like 5 years earlier than normal people, they do get cataracts.
Next question is, what type of lens are suitable for a diabetic 65-year-old patient after cataract removal? We are still unsure if you have astigmatism or cylindrical power also. Even after retina examination, we are still in a dilemma in choosing the lens.
So lenses, as far as the lens is concerned, even if you're a diabetic and if your retina is fine, you can go in for a trifocal also. There's no contraindication for going in for a trifocal. But as far as the toric is concerned, you asked whether the astigmatism, so that unless if we check the keratometric reading, that is one test which we do prior to the cataract surgery, what we call it as an IOL master, in which we will be able to find out the corneal curvature. So based on the cornea curvature, assume that the cornea curvature is more than 1 diopter, then basically we have to think about a toric lens. If it is less than 1 diopter, either a monofocal or a trifocal can go, as long as the retina is fine. If there are retinal problems, then that also can be combined with the cataract surgery.
So even those with astigmatism, if they want to go for trifocal, we have an option of toric trifocal. They can also go for a toric trifocal lenses.
And the next question is, if the person's age is more than 65, which lens would you be preferable for cataract, either monofocal or toric lens? As you have already answered that, but still they are asking, is the toric lens really required for a person age more than 65?
See, it is not about the age actually. It is about their visual needs and how comfortable they want to see after surgery. So if the patient is visually demanding, he wants perfect vision, he doesn't want to wear glasses post surgery, then obviously a toric lens, in case if he has got astigmatism, a toric lens would be better. Some patients are not very particular. They don't mind wearing glasses. They say, no, doctor, I don't mind wearing glasses after surgery. Then they need not go for toric lenses. See, obviously, toric lenses, when you go for, cost will be high. The affordability factor is also there. If you can afford, it is always, I always tell my patients, if you can afford, money is not a problem for you. You can go for the best possible lenses possible, because this lens is going to be in your eye for lifelong. So if you have astigmatism, money is not a problem, then you can go for a toric lens. If cost affordability is a factor, you don't mind wearing glasses post surgery, then you go for a lesser range IOL.
Just with your permission, doctor, I'll add one more, just one point.
Yeah, please.
In 1947, the lifespan of average Indians was around 37 or 47. Now, pre-COVID, they have taken a lifespan is 67. Maybe in another 10 years, it will be 80. So above 65, let us not consider your lifespan is going on increasing. To have a comfortable
Correct.
life, select a better lens is my way of suggestion.
Very
The
Yeah.
next
true.
question, doctor. My cataract is graded as NS2 in my report. My doctor says that cataract surgery will not improve the quality of my eyesight, but improve quality of my life as I need not wear glasses for myopia power is -5.
Mm. So when you have a -5, there is a dual advantage of doing the cataract surgery. So by doing the cataract surgery, your cataract is being knocked off. So once Madam said, as Madam said, that it's not going to form again. So the cataract is being removed, and your -5 also comes to zero. So there are two advantages to it. So definitely, I would recommend to undergo a surgery with the -5 and an NS2. Definitely needs a surgery without doubt.
And so one more thing is now this -5 could be because of the cataract increasing also. So if they don't go for cataract surgery, if you see now they change glasses. Now after 6 months when they come for checkup, again the glasses power would increase and the vision will drop down further. So the glasses power will also not remain constant. So once they get surgery done, the power will become stable and the possibility of vision dropping is also not there and the power of the glasses will also come down.
Next question is I have many floaters in my eyes and also ERM. So will cataract surgery improve my eyesight?
See, the quality of the vision definitely will improve if there is a significant cataract. But these floaters and the ERM, if it is significant, then it needs a VR surgery for removing the membrane also. If the ERM is not significant, not affecting the vision, then we can just go ahead with the cataract. By doing the cataract, the quality of the vision will definitely improve, but the floaters will continue to remain even after the cataract surgery.
Uh, Please tell which multifocal IOL lens gives a very good near vision.
So basically, we go in for a trifocal lenses, which gives both distance, intermediate, and near vision. So we can, when we are putting the lens, if you are very particular about reading very comfortably, we'll adjust the power of the lens in such a way that together with both eyes, your distance as well as reading will be fine. Trifocal will be the best lens possible.
Is trifocal suitable for people who drive at night? You already answered, but again, a
Yeah.
question from Shodhit
So
Sengupta.
basically, we have got a lot of patients who have undergone trifocal lenses and they're very comfortable driving in the night. But as you all know, with all the multifocal lenses, there is going to be some amount of glare and halos. So the halos is basically a small ring around a light. So that kind of a halos is very common with all the multifocal IOLs. So if you're very particular, I don't want any glare during my night driving, then basically you have to go in for a monofocal. But by going in for a monofocal, you will definitely need reading glasses. That is the disadvantage of going in for a monofocal. But if you go in for a trifocal, this minimal glare and halos will be there. But most of my patients are absolutely fine driving, reading, computers, everything. They are very comfortable.
The next question is most insurance is allowing only India-made lenses as per their policy and not imported. Hope the Indian-made lenses will really fulfill the need of surgery. Will there be any difference between imported and India-made?
See, basically, the insurance is what you have paid for or what your premium is. Based on that, only the allocation will be. Some insurance allocate even trifocal, some allocate only the Indian lenses, as you rightly said. But if you look at the quality of the lenses, say basically both are equally good. I wouldn't say that Indian lenses are they're like lesser, but at the same time, these are the imported ones are FDA approved and C certified. So if you look at the US lenses, those are FDA approved. So FDA, you know how stringent they are regarding the approval of the lenses. So you know how best the quality is going to be. And as far as the European countries are concerned, like Germany or any other European countries are considered, they have the C certification. The C certification is almost in par with the FDA. So you know that the quality of the lenses are the best as far as the imported are concerned.
The next question is there, can cataract surgery be done in both the eyes at the same time?
No, no. So usually we do not do both the eyes on the same day. So there are patients like who fly from outside the country and they come. So we see the eye post-operatively. We see them and they can get it done on the next day. But generally, as a rule, we do not do on the same day.
So 24 hours gap. So one eye they do today, the other eye can be done the next day. But very, very rare exceptional cases will be there where they are mentally challenged, or some patients like that who cannot cooperate, who cannot undergo GA for twice. Basically, those kind of patients, bilateral surgery can be considered, but that is an exceptional case where the child is having a cerebral palsy. The patient has to be taken under GA, where you cannot give GA twice. Those are the conditions where we can do a bilateral cataract surgery. Otherwise, it's always unilateral. One eye we do first, and once you're comfortable with that eye, we move on to the next eye. Within 24 hours to 48 hours, we can do the other eye.
My mom and dad had cataracts. Does that mean I will get it too?
Everybody born in this world will develop cataract. It is the time difference. It differs from person to person. So for some people, you can get at 40, some can get at 60, some can get at 70. So everybody will get it. It's a normal physiological change which anybody aging has to develop. So everybody will develop. The age is going to differ from person to person. That's all.
Does EDOF, external depth or EDOF lenses, eliminate glares and hollows?
So EDOF is definitely, as compared to a trifocal, the EDOFs are definitely better with the glare and halos because it acts like a monofocal, but at the same time, it has got an extended range of vision. So EDOF definitely, the glare and the halos are definitely lesser than the multifocals.
After all this, there is one more question. Is there an alternative option for removing cataracts without surgery?
No. At present, there is no. A surgery is the only option available now to get rid of cataract. Maybe in future, we'll see.
Can cataract be caused due to eye injuries?
Yes. It can. So we call it as traumatic cataracts. Eye injuries can cause cataract.
There's one more question. My doctor says that cataract is an elective surgery, even though my cataract is NS2, so I have to decide whether to have surgery or not. Also, I have eararm and floaters in my left eye. I have 6/9 vision, but in right eye it is 6/6. I find reading and watching TV difficult because of floaters and eararm. Will cataract surgery slightly improve my reading?
Whenever patient have cataract coexisting with other problems, like now this patient has got floaters and ERM. So we clearly tell them, so whatever vision he has lost because of cataract, he will get it back after cataract surgery. But these floaters, it will remain even after cataract surgery. And whatever the minimum quality of vision which he has lost because of the epiretinal membrane, that will remain even after surgery. So that he has to accept because he has got coexisting problem along with the cataract. Once surgery is done, whatever vision lost due to cataract, he will definitely get it back.
And most of the questions are over. And to the audience and as well as to the doctors, one more question has come. But in EDOF lenses, near vision is less than that of a multifocal. Is it correct?
See, basically, that's what. So in trifocals, you have all three different focuses which are there. In EDOFs, your distance and intermediate is going to be better. But we can do a mix and match kind of a thing where we adjust the lens. That's what I told you. Even in multifocals, we can adjust the lens. And even in EDOF, we can adjust the lens in such a way that together with both eyes, because we never see one eye like that. So together with both eyes, the distance as well as the near can be given 100%.
Do we need to come for an eye examination after surgery?
Yes, surely. At least 4 to 5 visits you have to come after surgery. It is actually to see whether how wound is healing, if there is any inflammation or anything, and whether you're following the drops or not. We will know how, just based on how wound is healing, we will know. So definitely 4 to 5 visits, minimum 4 visits will be required after surgery.
But after the surgery, after the glasses are being prescribed, or without the glasses also the patient is able to see very well, they have to have a yearly checkup as a must, because you're just removing the cataract, but other age-related problems like a diabetic retinopathy or age-related macular degeneration or increase intraocular pressure. So these are some of the conditions. Unless you come for a check, you will not know. So even after the cataract surgery doesn't mean that you will stop going to the doctor. You have to have a yearly checkup even after the final prescription and final everything is done for the cataract part of it.
Can these visits be in my hometown or at other Agarwals?
Very
How
well,
long to
very
use
well.
the eye drops after surgery?
Yeah, very well can be
So
done.
you
Because
know that
Agarwals
Agarwal.
has like nearly 160 branches now all over India, and it spread all over the world also. Now any branch, like they can get it done in whichever branch they want. And suppose like some come to their like a son's place or daughter's place, they get it done here in Chennai. And if they want to go back to the native place, very well it can be done. Surgery can be done in one of the branches, and they can follow up in any of our branches. They just have to carry the post-op file, and if they can enter any of our branches, and those post-op visits can be done.
And all the branches are connected by the single electronic medical record. So you need not worry. Everything will be there in the electronic medical record. So you just have to give your MRN number or your phone number. We should be in a position to take out your case sheet and we should be in a position to see the patient.
There is a question from Mr. Jairam Lu. When can I drive after the surgery?
Actually speaking, like two-wheeler, we ask them not to do it like for few weeks, because when they go in a two-wheeler, there's always chances of dust getting into the eyes. But four-wheeler, if you see, I think within 3-4 days actually they can start driving four-wheeler. That should not be a problem at all.
So most of my patients, when they come for follow-up, they drive and come. So it's absolutely no contraindication for driving, as long as the wound healing and other things are fine.
There is a question from Mr. Nasar Mohammed. I had my right eye cataract 2019. Last June 2023, I had my left eye cataract, and I had very vision problem. Why it is like that in his left eye? I think.
See, it could be various reasons actually. He has to come for eye checkup. It could be anything else also. He has to come for eye checkup to find out what it is.
There is a question from Mr. Piravi. His synergy lens gives all three visions very good without spectacles.
So synergy is in like an extended depth of focus, and it has a diffractive pattern also. So definitely it gives you a good range of vision, extended range of vision it gives you. So it gives you both distance, intermediate and near vision.
One more thing, doctors, wonderful. Almost all questions we have answered. Thanks a lot. Step by step, you have explained to us how the cataract, how safe it is, post-operatively how to feel. And at this moment, I would like to add that 1 millimeter, less than 1 millimeter, sub-millimeter incision to the world was introduced from the Agarwals. Our chairman, Amar Agarwal, first time he removed the sleeve and performed and showed how beautiful it is to do the surgery, as well as the glue diode techniques and various new techniques to the world. And he is one of the Agarwal doctors worldwide also, including the American Academy and other places. They go and present all these complicated cases and win many awards. And thanks a lot, doctor, and thanks the organizers as well as everybody. Any other further questions are there? So one question has come. Sorry. Please explain multifocal lenses.
So multifocal means multiple focal points. So there are 2-3 varieties of multifocals which are available. One is a refractive type, another one is a diffractive type. In refractive type, it's like you have a near rad and then you have a peripheral vision for distance. Like that, multiple ring segments will be there with the different powers, which helps us to focus. And the diffractive works in a different principle, in which the diffractive lines are there in the posterior part of the lens, which helps us to have a different focuses. So this is how the normal multifocal works.
One more. One question is which Indian brand lenses are good to choose? Question from Mr. Srini.
Basically, we will not get into the debate of Indian or imported or the company name, because that doesn't go well. Any scientific questions we are ready to answer.
We are anyway questions are not there. We can close it, and any further questions you can write to us at patientcare@dragarwal.com or call us at our toll-free number 919594924026. And thanks a lot, doctors. It was a wonderful explanation, and
Thank
it
you so much
removed the fear of the patients and all the doubts. Thanks a lot.
thank you so much
Thanks for
for
having us.
keeping a lively interaction. Thank you so much.
Thank you,
Thank you.
doctor. Thank you.